Well, welcome today to Operationally Speaking podcast. I'm your host, Tina DiMarino, and today we're going to be speaking with Becky Ziegler Otis about demystifying the RCM process within our ASCs. So please welcome Becky. Please tell us, about yourself and what you do and all the wonderful things that you are involved in.
Well, thanks, Tina. And I sure hope I can demystify it. That's a big word to try to do. So, my name is Becky Ziegler Otis, and I've been involved in the ASC industry for well over 15 years. And the majority of that time I spent as a administrator of a startup, physician-owned, multi-specialty surgical center located in central Wisconsin. And it really was in that role that I really began to understand what the revenue cycle process was and how very important it was for the viability of that startup organization. So that's where I got the majority of my experience. Currently, I work as the Assistant Executive Director of the ASC Quality Collaboration, which for those of you who are listening out there that are independent ASCs looking for some clinical benchmarks, check out the website, www.ascquality.org, for some free resources on benchmarking and toolkits. And I also do some work as an independent consultant for ASCs. And so, Tina, I am so delighted that you have me here today to talk about the revenue cycle.
Yes, thank you so much. When we're working with administrators and differing ASCs, we find that the RCM process is always this huge question mark. The only thing that we know is we need to get the money in the door, but that whole process and how we can really use that to our advantage and how we can get the money in the door quicker seems to be huge question marks. So if you can help us, with some important points, that would be wonderful.
Oh, that'd be great. So when I think about it, though, I have to start off sort of with the basics and making sure that everybody understands when you're thinking of the revenue cycle, really that whole process is not just the billing department. And I think that was a big aha for me, Tina, when I first started, because I thought as the administrator, I have a billing supervisor, they can take care of it, and my revenue cycle will be just fine. But the reality is that when you think about the whole revenue cycle, it's really all those businesses processes that together help us get paid for the services we provide. So
Right.
if you break that down for an ASC, it really is making sure that all of the procedures we perform, we get paid for. But we also know that there's such a challenge for us because, when you go to the grocery store, you pay for the goods and you take them home with you. When you go to a surgery center, you have your care provided, but we as surgery centers don't get paid for 30, 60, 90, sometimes even longer. But yet we have expenses. We have to pay the
Mhm.
staff.
Yeah.
We have to take care of the utilities. We've got to buy the supplies, and nobody wants to wait for their money. So we have a challenge in that regard, and it really boils down to the budget. We all have a budget. Our budgets are expenses, and we know what the expenses are. But if we don't have the revenue to support that, that's when we have a challenge. So really, it's all about that budget because we all know what a budget is, and we've got these expenses that we have to cover, labor, supplies, utilities, and we have to have the revenue to support it. And that's why that revenue cycle is so very, very important.
I couldn't agree with you more. To your point about the expenses, and as we all know, our expenses are continually climbing. Supply charges are climbing, so getting the money in the door even seems more paramount now.
Right. And when you think about it, I mentioned it's a complex process. And let me explain that a little bit, Tina, what I was referring to.
Thank you.
So we think that it's just really dropping that bill. But the reason that I want to explain that a little bit is that there's way more to it. So when we first put a case on our schedule, we're scheduling it. And you want to make sure that that case, that procedure that you're going to perform is actually one that you're going to get paid for. I mean, you don't want to do a procedure that's not going to be paid because honestly, that's going to impact the revenue on the back end. So it starts right at the beginning of scheduling. Then after you schedule the case, we typically register those patients. So many times we think about we can take the demographics, for example, that come from the doctor's offices, kind of pull that into our systems. Well, it's kind of like garbage in, garbage out. I mean, if that demographic system has a typographical error in a patient's name or a birth date or a subscriber number, Those are all things that are going to cause delays in getting that revenue in the door. And then it even boils down to the charge capture. I mean, we think about the role that our surgeons have to play. They actually do a dictation following the procedure. If they delay in doing that dictation, that's going to delay the process as well. So I say it's complex because it's not just dropping that bill, getting paid by the insurance company, and getting that money in the door fast. It doesn't happen quite that way.
Wow, there is a lot more to that when you kind of break it down into all those details. That's for sure.
Yeah.
Yeah,
And I also think, when you talk about demystifying it, Tina, I think about what should we look at as administrators? And
right,
so we should be looking at our revenue cycle reports, and we should look at them on a regular basis, on a monthly basis, maybe even more often. And when I think about the reports, always high level, we think about some metrics. And a key metric we all think about as it relates to the revenue cycle is our days in AR. I mean, everyone thinks about what is your days in AR? What does that tell you? So when you think about the days in AR, first of all, you have to understand what it is. It means the average number of days that it takes to get paid for a procedure. And so
right,
obviously, the longer it takes, 25, 30, 40, 50, 60, the higher that days in AR is, the longer it takes to get that money in the door. And
right.
so, but I've also been asked many times, well, what should that benchmark be? What should the benchmark be? What should we look at? And what I would tell you is that, first of all, know what it is, because you really can't measure something that you're not collecting the data on. So you've got to
Mhm.
measure that yourself, and you have to know where you are. So let's say over time you're 30, 32 days, 34 days, but over time you're creeping upwards. Well, that's going to tell me it's time to take a look at it. Something's going on. And it's hard to say that there's just a benchmark that you can, just paint all ASCs the same way. Because, for instance, if you're a single specialty eye center and you do predominantly Medicare patients, 98% of your patients are Medicare and they're cataracts, you're probably going to get that revenue in the door pretty quick after you drop that claim. And
Right.
so maybe your average days in AR is 25, 30 days. And that's great. But let's say you're a multi-specialty, or you're an orthopedic and pain center and you do a lot of work comp cases. To think that your benchmark would be 25 days is really unrealistic. You're talking
Right,
about, something maybe higher, like, 50, 55 days. So
right.
I think you have to measure internally, know where you're at, collect that data, decide where you want to be, and then look at those external data points to guide you as well, so that you can see if maybe there is, some opportunities for improvement.
Now, when you say you benchmark your data and you realize all of the sudden you were trending, 30 days or 32 days, and then all of a sudden you're at 45 and 60 days, what are some ideas that the administrator could do to help affect those numbers? What can we do to try to make it better?
Yeah. So when you see something like that, I say it's just the first sign. And what you have
Mhm.
to do at that point is start peeling back that onion, is what I would say. You've got to look deeper into what the data is showing you. And that's where there's some other revenue cycle reports that you can generate that can help you. So for
Okay.
example, when you're seeing that number go up, maybe one of the things you want to take a look at next is, how long does it take for you on average post procedure to drop that bill? So some people call it days to service to drop the bill. Some call it charge lag, whatever. There's different terms. But
Okay.
essentially, what you might want to do is dig in and say, what is the average amount of time it takes for me when I drop that claim, or when I have the procedure performed until I can drop that claim? What is that day? And then dig into that data, because you can break that down, for example, by payer. You can break or stratify that by surgeon. But what you're really looking for is a couple things in that. One of the pieces in that, I think, is provider driven. So, for example, from date of service to when the dictation is done, that's one piece of time. Tracking that, because we all know we should do our dictations as soon as possible. That's what CMS says. So you define that yourself. In my mind, it's like 24 hours. But let's say in tracking that, you are finding out that that is 2 days. It's on
Okay.
average taking 2 days. And then after it's dictated, it has to, or however you get your operative report done, it has to be signed off. And once it's signed out, then it can go into the billing piece. But
Right.
let's say you're using 2 to 3 days for that. You're already occupying 2 to 3 days. Now it goes to your billing process. So now your billing staff have to take that claim, they have to drop it, and then they send it out, and hopefully there's no rejection. But those are all pieces to that. And so peeling it back in the perspective of, for example, looking at a report that looks at data service to when the claim was dropped. And if you're, for example, at 7 days, that's too high. So I say
Right.
that out loud because you have to figure out what that is. But I would suggest 2 to 3 days, because when your days are incrementally increasing for days
Right.
in AR, a piece of it can be by you not getting that bill out the door as fast as you can. So
Right.
that's one way. I also say take a look at your clean claims, the claims that make it through that clearinghouse. What percentage of them are making it through without any errors? And
Okay.
so take a look at that and measure that. And that should probably be 97, 98% of them should be going through. And if they're not, take a look at why they're not. Is it medical necessity issues? Is it prior authorization issues? Is it coding issues? But knowing what that is, where what the trends or patterns are showing you in that, can help you with identifying what might be causing that incremental increase overall in your days in AR that you want to take a look at. So those are just some example what I call peel back the onion reports that can help you identify further what might be causing this issue so that you can dig into it a little bit more.
Oh, well, thank you for that advice. Really peeling back that onion as you're mentioning, you brought up a few points that I hadn't thought of before. And, sometimes in our surgery centers, the physician may not right away dictate, their operative report and things. So, really, if you don't have that mechanism in place for timely, collection of that to get it to the billing department, that can really affect, how quickly you have that cash on hand that you need to pay your expenses. So thank you for that advice.
Yeah, you're very
Definitely.
welcome.
Yeah.
And, and actually, when you're looking at another type of report, Tina, the one that we frequently think about is it's called the aging accounts receivable report.
Yes.
And that's a very important report to look at because that's going to provide some insights that might be payer specific or biller specific, for example. So in those reports, you're taking the amount of money that's owed you and you're categorizing it by what's owed you within the past 30 days, what's owed you within the past 30 to 60 days, what's owed in
Right.
the past 60 to 90. And so looking at that and where you want to be, and I always had a goal for myself that I wanted the majority of my revenue that's owed me to be in the 0 to 60 day bucket. So I
Right.
did my total, and if I didn't have 70 to 75% of that amount that was owed me in that 0 to 60 day area, gave me something to look at. And
Right.
maybe it's something payer specific. Maybe you're having a payer problem. Maybe, you're having issues with getting your implants paid, for example, if you're an orthopedic facility. Or maybe you've got issues with internal staff. Maybe you've got certain staff members that take care of particular payers or alphabetically within different payers. And
Right.
maybe there are some problems there that need to be looked into or addressed. And I think that that can provide you with some insights as well.
Right, right. We've worked with a physician recently who they hadn't been looking at that report. And when they did, they found they had like 32% was in the 120 plus bucket.
Oh,
And
wow.
so it was like, yeah, like, isn't there a saying like if it's, the further out that it gets, the harder it is to collect?
Mhm.
And so he worked really hard to collect the majority of that. But, just having something like that kind of drop off the radar for whatever reason, can really put you at risk too for, getting the monies in the door for whatever
Right.
reason. Yeah.
Right. And the longer that AR stays out there, that money that's owed you that is out there, it's actually more costly to collect. I mean, if you
Uh,
can collect that right up front, it's less
right.
expensive, it's less staff time and, invoices and however, you're getting paid for it. It just makes things much more efficient, much more
Right.
efficient.
Right. Right. Now, all great points. Absolutely.
And
Uh,
and I think there's no reason why you can't benchmark yourself against other organizations as well. I mean, I think about look at different ways. When I think about what's out there, Tina, what could we do differently in the world of the revenue cycle? What's coming down the pipeline for us?
right.
What could we do differently? And I think about some things that maybe you can think about yourself, but there's bots, there's, the artificial intelligence, everybody's got
Right.
different terms for it. But, those bots can really help you with maybe automatic prior authorizations,
Right.
with, communications with patients. Some of those things that we do over and over and over again might be something that you can transition into something like that. I
Right.
also think about, reports, business intelligence reports. So if you're not using a business intelligence report where you're maybe taking your claims data into that and you can look at that, like visualize that, turn that into real information, might be something you might want to consider. There's a lot of centers I know that use Microsoft. So the
Mhm.
Microsoft products. So I believe Microsoft's BI tool is called Power BI. So that might be something, if you haven't used that, it might be something that you might be interested in. If you're not using Microsoft, I know there's Tableau, and I believe that's by Salesforce. So
Yes.
another
Mhm.
one that you could tap into. But I think those can be very helpful because sometimes if you're just looking at a number of Excel spreadsheets, all on top of each other or reports month by month, it's hard to visualize what it is you need to improve upon. And I think they can really help you pinpoint where you might want to go with improving your potential problem areas or enhancing your efficiencies.
Wow, that is truly great advice. We are hearing, even daily, more and more about processes that we do repetitively, how AI can really help us do that. And to your point, or do it more easily, I should say. And to your point about, I'm familiar with Tableau, and to turn those into more graphic models or to pinpoint areas. I'm just starting to really dive into that, and I agree with you. It really helps pull it forward. My eyes start crossing, once you're just looking at an Excel spreadsheet after Excel spreadsheet, or just raw data, and without putting it into something that looks more meaningful, or really puts that point across as to, here's where you really need to dive in and figure out what's going on. So I think that that's great advice, great advice. And I think we'll all start, you know, if we're not already, start utilizing more of the AI functionalities that we can to make our jobs easier.
Yeah. Yeah,
Yeah.
good point. Good point. And you started off with, talking about demystifying. So when I
Yes.
think about demystifying, I think let the data and let the information help you demystify. Break it down like you would anything else. If it seems to be complicated, break down those individual steps that are part of that whole process and one by one dig in and look to see where there's some variability, some opportunity for improvement, instead of thinking you have to do it all at once. And
Right.
slowly but surely, then you will be able to address any of those, AR issues that you have, breaking it down.
Right, right. I think that's wonderful, and really kind of takes those big question marks out of the way, and breaks it down. So I love that, Becky. Thank you so much. I know a lot of us need to hear that, and need to recognize that you don't have to conquer the world all at once. Take a piece of it. If you're having an issue, fix that process and move on to that next piece. And soon, by the time you're at the end of it, you'll have a really nice process. And then having that nice process in place will make it easier for you to see when something goes, as unexpected according to your benchmarks, and will help you or allow you to kind of pinpoint it more quickly.
Correct, correct.
Yeah,
And
yeah,
Tina, there's so many resources out there now, I think, that can help administrators with this. I mean, so if you're struggling out there and you're wondering where can you go for some help, some resources, boy, podcasts, like this. There's
right,
also, many of those revenue cycle companies offer free webinars or, webinars maybe that you don't have to pay real much for that you can listen in on. And I know when I was doing that role, I would listen to whatever I could. I would read whatever journal article I could find because I always felt like there was a pearl. Somehow I got a pearl out of it.
right,
You're a member of ASCA, all their education programs are included in your membership now. And there's
yeah,
a finance course that has lots of sessions on the revenue cycle that I think can be very helpful. And just asking your colleagues, don't be afraid to reach out and say, I don't understand this. Help me understand this. This doesn't make sense to me. What is accounts receivable? Just kind of put it in my terms. But we're an industry of helpers. We all help one another. So if you're concerned or confused in any way, I say reach out to your resources because people are there to help you.
yes, absolutely. It may seem like the ASC industry is this huge, situation, but in reality, our industry is actually small. Everybody knows everybody, and we do.
Yeah.
To your point, we all work together. So, and that's why we're doing this. This is why Becky's, certainly taking the time out of her day to join us. Thankfully, because we all do appreciate helping one another, and we do have a lot of new administrators out there. And so I know myself, I didn't even begin looking at the RCM right away. That was like, I was more worried about other things at that time,
Sure.
so definitely, reach out, and, we're all here to work together. And, no, this is great information, Becky. We can't thank you enough for joining us today on Operationally Speaking.
Well, thank you, Tina. I appreciate having the opportunity. It was wonderful to join you as well today. Thank you.
Thank you.